Hello everyone, this is Dr. Sangeetha. I am endocrinologist. I am practicing at Tanishta's Diabetic Endocrine Center and Kidney Center at 𝗚𝗲𝘀. How do you diagnose diabetes? If a patient is asymptomatic, usually we ask the patient to go for the screening for diabetes based on the risk factors. So for the screening of diabetes, usually the test recommended is the glucose tolerance test. That is, the patient is asked to go to the lab in the fasting state, and after that the patient is submitting the fasting blood sample. Then the test is known as a 75 grams oral glucose tolerance test. That is, after giving the glucose, the patient is supposed to submit the blood sample again after 2 hours. This is for the non-pregnant individuals. For the pregnant individuals, usually the test which is done is the 75 grams oral glucose tolerance test in pregnancy. That is, after giving the blood sample, you take 75 grams of glucose, but you are going to submit the blood sample at 1 hour and 2 hours after the glucose ingestion. Mind you, in these 2 hours, you are not supposed to take anything else except the glucose water which is provided by the lab. This is the way you usually diagnose the diabetes. Other than this, the one more criteria which is really helpful in the diagnosis of diabetes is the 𝗧𝗶𝗴H. This is the average blood sugar over the past 3 to 4 months. Just by one sample, you can just analyze what is the average blood sugar over the past 3 to 4 months. So coming to the criteria, if the fasting blood sugar is more than 126, or in a non-pregnant individual, if the glucose, post-glucose blood sugar is more than 200, then you can label the patient as diabetic. Similarly, a 𝗂𝗶𝗴H value more than 6.5, you label the patient as diabetic. In pregnancy, the criteria will be different, but these are the common criteria which we use for the diagnosis of diabetes. But along with this, if the patient is symptomatic, hyperglycemia, that is, as we have already discussed, that is loss of weight, increased thirst, hunger, or if the patient is having any tingling, numbness or blurred vision, random blood sugar of more than 200 also, usually it's suggestive of diabetes, but the best criteria is to go with the oral glucose tolerance test. Awareness is the first step for good health. Please take care. Have a good day.